Hello, my name is Dr. David Flanigan from the Ohio State University. It is my pleasure today to discuss with you the all-inside repair with Fastfix Flex. Why do I like Fastfix Flex? Well, this is truly a wonderful and unique device that allows us to not only bend the needle, but also the shaft to get to many different areas within the meniscus that often were very hard for us to approach for an anatomical repair. Where do I use this, right? So the three main tears that I would say I use the most are the ramp lesions. Especially with this, I'm able to get good compression of the ramp tear and allow it to get underneath the meniscus and above the meniscus to really get a good solid compression against the capsule. Peripheral tears, very similar to Fastfix 360. This is kind of the workhorse for me when we're looking at peripheral tears throughout the meniscus. And what I really like again about this one is now I can approach different tears that I wasn't able to before with an all-inside technique, primarily in those anterior and middle zones, which are often difficult to reach with our normal devices. So this allows me again to bend the shaft and allow me to get to those areas and those zones for an excellent repair. So let's talk about a Fastfix Flex case here. So first and foremost is checking that access for the meniscus tear. Then we want to adjust the needle and finally adjust the shaft of the curvature, especially for these more anterior or middle zone tears. I often will look at using an accessory portal that might be a little bit further outside. All these type of tips and tricks are going to allow me to get the best access possible to this very difficult zone that was pretty much unreachable before with all inside devices. But now with the Fastfix Flex, we can get to these areas for an all inside anatomic repair. I've now deployed T1. I usually will go through the meat of the meniscus at first. And now as I pull this back, all I'm going to do is now place this in that capsular area and deploy T2. Once I've done that, very much like before with any type of Fastfix device, I'll just use steady pressure to reduce the meniscus to a nice, stable repair. The NOVOCUT Suture Manager is actually phenomenal for this. I use this as well with my NovoStitch Pro. We can get an excellent cut of the suture from that. What I like again about the Fastfix Flex, just like all the other predecessors, is that you have both a curved and reverse curved. Here again, we're deploying through the meniscus first, and then finally through the capsule, steady pressure, and then a reduction of that meniscus. So as you can see here, this is a great tool that you can use for these anterior and middle zone meniscus. It's great for our armamentarium within the meniscal repair. I think you are going to enjoy using the Fastfix Flex as much as I have. Well, I hope you've enjoyed the video that we had today in regards to a meniscal repair with Fastfix Flex. So what do we do next, right? My normal postoperative protocol for this is a protected weight bearing for about 4 weeks, especially with these more peripheral tears. I do feel like you can weight bear during that time. It allows that kind of compression against the capsule and hopefully for healing as well. But we want to protect it during that first 4 weeks. My goal is full range of motion by 6 weeks. And then they are going through a very structured rehabilitation with both strengthening and then finally getting back towards agilities. Our goal is to get them back towards sports within 4.5 to 6 months after the procedure. Thanks again for listening to us today on this great new technique with the Fastfix Flex for an all-inside meniscal repair.